Nursing home residents, some nurses and doctors and the elderly are still waiting for the COVID-19 vaccine. But tonight, News 5's Kayla Perney found out it was offered to Carter County commissioners, and at least one accepted the offer.
This is the email Mayor Patty Woodby sent to Carter County commissioners telling them the county health department received extra doses of the COVID-19 vaccine. The mayor says, "I would like to offer this to you and your family members." Woodby told commissioners they would be on a priority waiting list if supplies ran out. Commissioner Daniel McInturf was out of town and didn't get the shot.
Do you think that offer should have been made?
I don't believe it was sent to just commissioners. But again, I can only speak for myself, and me personally, I would have not used my dose. I would have obviously passed it on to someone in more need.
Mayor Woodby declined our interview request. She said over text message the extra vaccine never arrived and commissioners did not get doses. But Commissioner Mark Blevins said he and his wife did get vaccinated. He abruptly canceled our interview. Other commissioners declined or didn't answer. The Carter County Health Department sent a second nearly verbatim email also offering the vaccine to school teachers.
In the commission meeting the other night, that was not mentioned that it was going to be offered to teachers and people. It was just, nurses and doctors and first responders. So I didn't believe it.
Tennessee's official distribution plan says only frontline healthcare workers and first responders should get the vaccine now. Regional Medical Director Dr. David Kershke explained Wednesday pharmacies will give the vaccine to nursing home residents next week.
After the 1A1 group is 1A2, which is set, so that's community healthcare providers. So that's all of our healthcare providers that are not associated with hospitals.
Leaders of other counties and cities say they didn't get the same offer of early access. Sullivan County Mayor Richard Venable says he doesn't agree with it. Political people should get in line with everyone else. In Carter County, Caleb Perney, News 5 WCYB.
Now, in the last hour, Mayor Woodby said by phone she offered the vaccines to commissioners at the direction of the county health department. The department's director has not answered our request for comment. A state health department spokesperson said in a statement that approved providers are distributing the vaccine in accordance with the state's plan.
It just reminds one of preferential treatment.
Tonight, the Tennessee Department of Health is blocking all interviews after the Carter County Health Department offered county commissioners to jump ahead of others and get their COVID-19 vaccinations early. News 5's Caleb Perney presses for answers about why it happened and if anything will be done about it.
A spokesperson for the Northeast Regional Health Department said no to all interviews, instead pointing back to a statement released from the state level last week. Tennessee is working to vaccinate our phase 1 populations as quickly as possible. COVID-19 vaccine supplies remain extremely limited at this time, and approved providers of the vaccine are administering it in order of priority as described in our COVID-19 vaccination plan. A state spokesperson did not respond to additional questions.
They're public servants and they should really be open to the public and answer any questions. That's what their job is.
The silence coming after a pair of emails offering the vaccine to Carter County commissioners and teachers out of turn. Some residents thought maybe it was because the job puts commissioners at more risk. No other local governments were given the offer.
If they're in the public light and they see people close to close, in meetings, that they should have it so they don't pass it on to anyone.
Mayor Patty Woodby says the health department was considering commissioners as critical infrastructure when she was asked to send out the email. But Tennessee's vaccination plan puts critical infrastructure after people with high-risk conditions, after healthcare workers, after first responders, and after people in nursing homes. That's where pharmacies just started vaccinations this week.
I just think they should have followed CDC protocol and offered it according to their guidelines.
Ballot health officials say they have protocols to prevent the wrong people from getting the vaccine in hospitals.
When someone comes in to receive the vaccine at one of our 5 pods, they have to show identification.
In Carter County, the incident has become a political football. Multiple commissioners who either ignored or refused our interview request Thursday spoke to other news outlets to denounce the vaccine offer after News 5 revealed the emails. And a popular Facebook page is now pushing an online petition calling for Mayor Woodby's removal. Do you trust the health department now to give out these vaccines to the right people?
I still have faith that they'll do the right thing. I'm sure they had good intentions.
In Carter County, Caleb Perney, News 5 WCYB.
Ballot Health and local health departments began vaccinating community health care providers today. CVS and Walgreens are vaccinating in long-term care facilities through a federal partnership.
Tonight, News 5 has obtained more than 100 emails between the Carter County Mayor and the Health Department. News 5's Caleb Perney shows us the behind-the-scenes conversation and confusion that led to commissioners being offered the COVID-19 vaccine before it was their turn.
More than 170 pages of emails obtained by News 5 through a records request confirm Mayor Patty Woodby's assertion that County Health Department Director Caroline Hurt told her to invite commissioners to get so-called extra doses of the vaccine. Her emailed Woodby a script to send to commissioners. Woodby sent that message nearly unchanged, adding that commissioners should bring their high-risk family members too. Woodby says that was based on a phone call with Hurt.
My mother's age, who's nearly 87, and people in nursing homes, they should go next. So for somebody to cut in front of the line, I think is just disgraceful.
Emails reveal confusion and chaos when those extra doses didn't arrive. Her emailed Mayor Woodby as vaccinations were starting to take back the offer. Then another email when vaccines ran out and the health department had to turn people away. Nurse Emily Ayers had to wait to get her shot.
I didn't think that was very fair. That wasn't right. The people who are not able to work from home, not able to social distance in their jobs should get it before anyone else, in my opinion.
That evening, her emailed city, county, and school leaders to explain the situation, saying she had wanted to give the extras she expected to people in the next phases, including 1B, which she described as people who are exposed in their daily work. But Phase 1B was actually people with high-risk medical conditions. Even updated guidance does not put commissioners ahead of the general public. Once News 5 uncovered the offer, Regional Medical Director Dr. David Kershke sent an email to regional leaders Christmas morning. He explained health departments had to change plans fast after learning the night before distribution that a shipment of vaccines for the next week would arrive early, but then didn't actually come. He said the plan was never to go beyond Phase 1A, except in a few counties. In an email directly to Mayor Woodby, Dr. Kershke said he would take responsibility if it wasn't clear that health departments were still following the state's plan.
I think they need to be forgiven and just move on. I don't really think there needs to be any repercussions right now. Maybe an apology from them would be appropriate.
In Carter County, Caleb Perney, News 5 WCYB.
Mayor Woodby says she questioned the offer to commissioners since it didn't match state guidelines, but she says she trusted the health department. Woodby declined our interview request, saying she has already received threats and fears that it would make things worse. A state health department spokesperson would not allow us to interview any local health officials. The spokesperson said in a statement that she is aware of reports of people jumping line, but did not answer questions about if anything would be done about it. Happy New Year's Eve. I'm Rebecca Pepin.